This video will illustrate how a TFCC, or triangular fibrocartilage repair, is performed. This is a structure very similar to meniscus in the knee. It causes pain typically with rotation, in this case in a high-level tennis player. Standard wrist arthroscopy is done with traction on the wrist, and we insert a small 2.7 millimeter camera into the wrist joint, which will allow us to identify the pathology and confirm our MRI findings. Here the frayed tear is seen, as well as synovitis, or inflammation of the joint lining. The removal of this tissue is done to not only remove pain, but in this case to encourage bleeding and scar formation so the cartilage repair can heal. We will repair it using sutures that are passed all arthroscopically in order to avoid a large incision, which leads to more pain and slower recovery. With two sutures and traction, we can see that the repair is closed. We look in the midcarpal joint, which is another portion of the wrist joint, for any other associated pathology, such as a ligament tear. In this case, we see that the probe cannot enter the interval between the two carpal or wrist bones, and hence no pin fixation will be necessary. Other intervals, such as between the capitate and hamate, are also noted. The sutures are tied externally once traction is placed on them, which closes the tear as seen here. The wrist will now be held in supination, or with the palm facing the patient, and the portals are simply closed with benzoin and steri strips, which are basically butterfly bandages, in order to avoid any scarring. No sutures are necessary. A well-padded splint is applied until the following week in the office, where the patient will have a light cast applied. This is all done ambulatory with local anesthesia.